Hello, I am Bhaskar Patel. Coronavirus COVID-19 guidance. COVID-19 is a new illness that can affect your lungs and airways. It's caused by a virus called coronavirus. Everyone must stay at home to help stop the spread of coronavirus. This includes people of all ages, even if you do not have any symptoms or other health conditions. You can only leave your home to shop for basic essentials, only when you really need to. To do one form of exercise a day, such as a run, walk or cycle, alone or with other people you live with. For any medical need, for example, to visit a pharmacy or deliver essential supplies to a vulnerable person. To travel to and from work, but only where this is absolutely necessary. If you have a high temperature, you feel hot to touch on your chest or back, a new continuous cough. This means you've started coughing repeatedly. You should stay at home and follow the isolation guidance for households with possible coronavirus infection. Gatherings of more than 2 people in public, including religious gatherings, except for funerals, are banned. It is important that you follow this guidance. You could be fined if you do not. The police, immigration officers, and the army may play a role in enforcing public health measures, as well as ensuring food and other essentials are delivered to vulnerable people. Due to the coronavirus, the requirement for reporting as a condition of immigration bail has been temporarily suspended. You will receive an SMS text message with details of your next reporting date. For more information on changes to the asylum system, visit the website www.refugeecouncil.org.uk. Coronavirus can make anyone seriously ill, but there are some people who are at a higher risk. For example, you may be at high risk from coronavirus if you have had an organ transplant, are having certain types of cancer treatment, have blood or bone marrow cancer such as leukemia, have a severe lung condition such as cystic fibrosis or severe asthma, have a condition that makes you much more likely to get infections, are taking medicine that weakens your immune system, are pregnant, and have a serious heart condition. If you think you fall into one of these high-risk categories and have not received a letter from your healthcare team by Sunday, 29th of March 2020, or been contacted by your GP, doctor, you should discuss your concerns with your GP, doctor, or hospital clinician. If you don't have a GP, contact Doctors of the World UK for support on 0808 1647 686. This is a free number to call. I repeat, 0808 1647 686, or email clinic@doctorsoftheworld.org.uk. If you're at high risk of getting seriously ill from coronavirus, there are extra things you should do to avoid catching it. These include not leaving your home. You should not go out to do shopping, pick up medicine, or exercise. Stay at least 2 meters, 3 steps away from other people in your home as much as possible. Ask friends, family, or neighbors to pick up shopping and medicines for you. They should leave them outside your door. If you need help getting deliveries of essential supplies like food, you can register to get coronavirus support. You are strongly advised to stay at home at all times and avoid any face-to-face contact for a period of at least 12 weeks from the day you receive your letter. Read the full advice on protecting yourself if you're at high risk from coronavirus on government website www.gov.uk. Isolation guidance for households with possible coronavirus infection. Do not go to work, school, GP surgeries, pharmacy, or hospital. Use separate facilities or clean between use. Avoid close contact with other people. Have your food and medication delivered to you. Do not have visitors. Sleep alone if possible. Regularly wash your hands. Drink plenty of water. Take paracetamol to help with your symptoms. For more information, see www.gov.uk. Anyone with symptoms should stay at home and isolate for at least 7 days. If you live with other people, they should stay at home and isolate for at least 14 days to avoid spreading the infection outside the home. But if anyone in your home gets symptoms, they should stay at home and isolate for 7 days from the day their symptoms start, even if it means they're at home for longer than 14 days. If you live with someone who is 70 or over, has a long-term condition, is pregnant, or has a weakened immune system, try to find somewhere else for them to stay for 14 days. If you have to stay at home together, try to keep away from each other as much as possible. When should I contact NHS 111? You feel so ill that you can't do anything you usually do, such as watch TV, use your phone, read, or get out of bed. You feel you cannot cope with your symptoms at home. Your conditions get worse. Your symptoms do not get better after 7 days. How do I contact NHS 111? You can use the NHS 111 online coronavirus service to find out what to do next. If you cannot access online services, you can call 111. This is a free number to call. You can ask for an interpreter in your language. What will happen if I am worried about my immigration situation? All NHS services for coronavirus are free for everyone regardless of their immigration status in the UK. This includes coronavirus testing and treatment, even if the result is negative. NHS hospitals have been advised that no immigration checks are required for people receiving testing or treatment for coronavirus. What can I do to help stop coronavirus spreading? Make sure you wash your hands frequently, using soap and water for at least 20 seconds. Follow advice about staying at home. This advice is based on NHS health advice and information, and it is an advice for everyone in the UK, regardless of country of origin. For more information or guidance, visit NHS website and WHO website. This is version 3 on 24th of March 2020. Stay healthy and stay safe and look after yourself.